Hello, I'm Dr. P.J. Mazumdar from Arogyam Hair Transplant and Cosmetic Center. So today I'll discuss with you 20 facts about hair transplant that are very important for you to know. Like things like how costing of hair transplant is done, what are the latest technologies in hair transplant, what is the level of pain in hair transplant, and importantly, how will you know how many grafts you have been given? How is the costing determined on terms whether it is determined in terms of hair or grafts? Then how will you determine whether a hospital has sufficient infrastructure for hair transplant? And there are so many other important points that you need to know before deciding on hair transplant. So I hope that by the end of this video, I'll have given you sufficient information so that you can make a correct choice of the clinic and doctor for your hair transplant procedure. So point 1, when is hair transplant not necessary? So hair transplant is not necessary in all cases. Especially it is not necessary in very young patients. In an 18-year-old patient, in a patient who wants facial hair at the age of 20, in patients who have just started to have hair loss. If we do hair transplant at that stage itself, in the long term, it harms the patient. So we should avoid hair transplant at these stages. Point 2. When is hair transplant contraindicated? So there are two conditions in which hair transplant is actually contraindicated. These are diffuse unpatterned hair loss, diffuse unpatterned alopecia. So this is a condition when there is hair loss all over the head. There is no definite pattern to this. So in that case, where will we do hair transplant? Where will we take the hair and where will we plant it? Second is retrograde baldness. So in some patients, they develop baldness from behind. So in that case also the donor area itself is compromised. So there also we cannot do hair transplant. So point 3. Now I want to discuss about the hairline. So the first point is the symmetry of the hairline. When we draw the hairline, both the sides must be symmetrical. They must match. And to ensure that there is complete accuracy, we use this laser hairline device. So as you can see, there is a mark here. So we use it on the forehead and then we can make the hairline completely symmetrical. This is very essential, an essential part of the whole process.